So the question here about the chest tube, I said, and the question, if I read again, the nurse is assigning the functioning of a chest tube drain system. So why? Because of any thoracic surgery, like tumor in the lungs, or pleural effusion, massive pleural effusion, hemothorax, right? That times we have to remove, and we use the chest tube like this. So my first question here, what are the use of chest tube? So chest tube we use to remove the air, or chest tube we use to remove the fluid from the pleural space or from lungs. So what we learned? We learned this is the chest tube, is a device. We use it to remove excess fluid or excess air from lungs, right? So basically this chest tube help to re-expand the lungs. After the surgery, we have to have something to help the regain the function of the lungs. This chest tube can help re-expand the lungs, I said. So in case of pneumothorax, pneumothorax means air in the pleural space. In case of hemothorax, hemothorax means blood in the pleural space. So if patient has a hemothorax or pneumothorax, we use this chest tube to remove the air or fluid or blood. In some cases, if you ask me, if any patient has a blood and air both in the lungs, like road traffic accident, ribs are broken very badly, right? Patient air inside, blood inside. So if both blood and air both in the pleural space, also we use the chest tube. So if blood and air both in the lungs, it is called hemopneumothorax. Hemopneumothorax. So chest tube we use for remove the air, remove the fluid, or remove both. So chest tube we use for pneumothorax, hemothorax, or hemopneumothorax, right? So keep in mind here, normal breathing. So our lungs can work on negative pressure. So when the negative pressure creates inside the lungs, lungs can work. It is normal body physiology. So any kind of medical emergencies like tension pneumothorax, I mean air get stuck in between the lungs and chest wall, which can be caused by the trauma or any kind of surgery or fall and broken the ribs, or outside air create a one-way valve inside the lungs. So I'm talking about if any emergency medical situation or condition like tension pneumothorax, right? that times we use it. But when tension pneumothorax form because of any kind of bad trauma, any kind of surgical operation after surgery, or like patient is fall somewhere or road traffic accident and ribs is broken. So these times negative pressure inside the lungs will imbalance. That times we need the chest tube. So sometimes even board can ask, what are the clinical sign of tension pneumothorax? This is little bit different, but little bit relevant. So I want to share here now. So in case of the tension pneumothorax, usually trachea is shifted, blood pressure go down, heart rate go up, lung expansion go down, oxygenation go down, and also jugular vein will be distended. Whatever, this is not the topic right now. We are talking about the chest tube, how chest tube set up, right? So if we go in this picture, you can see here, right? This is the chest tube or chest tube drainage system. So here, yes, I told you this is the chest tube, right? We put in the patient bedside, but real structure is here. So chest tube has a 3 parts. Chest tube has a 3 parts. So all chest tube system have the 3 chamber. One of the chamber is called collecting chamber, right? One is called collecting chamber. The other is called water seal chamber. The other is called suction chamber, right? And the other is called drainage chamber or collecting chamber. So if you read the name of these 3 chambers, you can find out so many things according to the name. So like example, drainage chamber. This is the drainage, this is the drainage chamber or collecting chamber, I said. Mean what are the secretion accumulate in the lungs will be drained and collected in this chamber, right? So if you read this chamber, you can get a record how much fluid is collected. So record the drainage system we can found in the drainage or collecting chamber. It is very important. We are RN, right? Every shift or every 8 hours, we have to check this, how much collection is there. And we have to notify healthcare provider or MD. So I said, we have to read the record drain in the drainage chamber or collecting chamber and then notify to the healthcare provider. If the drainage, I mean, if the reading in the collecting chamber or if the drainage is greater than 100 ml per hour, right? I said 100 ml per hour. If I go back in this question, 50 ml drainage in the collecting chamber, right? So it is not more than 100.
It's good.
I said, if more than 100, this is the indicator of danger, right? So just listen me, please. If the drainage greater than 100 ml per hour or bright red, the collection or secretion in this tube is so bright, means blood is coming, indicate the hemorrhage. Hemorrhage means blood loss. Definitely hemorrhage inside the lungs, so blood is coming in the drainage chamber. We have to notify healthcare provider. So I want to recap it. So like you are working in the hospital and you have night shift or day shift. So every shift you have to read the amount of the fluid is came. So if I say the drainage is more than or greater than 100 ml per hour, indicate there are emergency, you have to notify healthcare provider. If you see very bright red blood, you have to notify healthcare provider. Red blood means hemorrhage, internal hemorrhage inside the lungs. So blood is coming there. And now go the water seal chamber. Water seal chamber, it is here, it is here. So water seal chamber basically, we have to make sure, nothing come in water. So while the air come out, okay, so I said the water seal chamber can contain a certain limit of water. So this water has some bubbling. So why bubbling? Because air is coming from the lungs, so we can see a certain amount of bubbling. If there is no bubbling, it is bad sign. If there are too much bubbling, it is also bad sign. And fluctuation of the water indicate the respiration is going on. So as I told you, the water seal chamber, we have to get some bubbling, but continuous bubbling or intermediate bubbling, it is important we have to know. So if the bubbling in the water seal chamber is continuing, so continuing bubbling is the water seal indicate there is something wrong or bad sign, means indicate the leakage. The question come in the board. If the water seal, we can see continuous bubbling, what are the problem? It indicate there are leakages in the system. But intermediate bubbling is in the water seal is a good sign. Okay, so intermediate bubbling in the water seal is the good sign, I said. So what we have to know for NCLEX board exam from here, we have to know the water seal bubbling is okay, but bubbling will be intermittent, not continuous. If continuous bubbling, it is a bad sign. It indicates there are some leakage. And intermittent bubbling in the water seal indicate good sign. We have to know this one. Now go for suctioning tube. Here, suctioning tube. This is the suctioning control tube. This is a controller, but suctioning tube is here. So suctioning tube basically, we have to measure the amount of suction. So also it is important, we have to use this controller for amount of suction, how much apply. For different patient it should be different, but doctor should be applied this one. I mean, select the how much suctioning will be. So keep it in mind, continuous suctioning, right? Doctor determined how much suctioning need from the chest tube, right? So this is the control. So doctor or MD can determine how much it would be, right? It is very important. Now come the indication, bubbling. If we see here the bubbling, just opposite what we see, water cell. Water cell, I said, intermediate bubbling is good, continuous bubbling is bad. Just opposite this in the suctioning tube. Suctioning tube say continuous bubbling in the suction tube is a good sign. Intermediate bubbling or intermediate suction is a bad sign. So what we learn in the water seal chamber, it is just opposite in suctioning control chamber, right? So I just want to make little bit summary about this suction and water seal chamber. As I told you, continuous bubbling in water seal is a bad sign. Intermediate bubbling in water seal is good sign, right? So it is just opposite in suction control tube. In suction control, continuous bubbling is good sign and intermediate bubbling is a bad sign. So now just go through some type of question in NCLEX board. So first question can come, how we have to take care of a chest tube, right? First of all, the care of a client with a chest tube, if I said, we have to access or assessment the client for respiratory distress. So a patient has a chest tube and patient has a respiratory distress, it indicates there's something wrong. So assessment that client for respiratory distress, or we have to assessment the breath sound. So if there are no air sound or normal breath sound, it indicate good. And also we have to check the vital sign, means respiratory rate, pulse rate. So if vital sign is normal, we can say everything is going on good, right? So what we have to check? We have to check respiratory distress. We have to check the breath sound by stethoscope. We have to check the vital sign during the using the chest tube. So chest tube should be always placed below the chest level. So in this picture, we can see the chest tube is put on the bed rail, but it always must be below the chest level. This is the question NCLEX board asks. Chest tube should be placed below chest level. And also, do not, I said do not strip or do not strip the chest tube without doctor order. So means we do not clip or strip without doctor order. We do not do. And also daily chest X-ray are needed to check the fluid removal. So how much fluid is removed from the chest or air should be removed from the chest to make sure by chest X-ray. Chest X-ray. So also client will be, also I said, client will have the occlusive dressing is inserted side. So the chest tube where we put in the, okay, so in this picture showing the chest tube is put it here, right? So second picture, this is the dressing. So when we put the chest tube, this is the chest tube channel and this is the incision site. So when we put the chest tube, always we have to keep in mind, client will have occlusive dressing at the incision site. If we see anything red color or this is the fluid coming, indicate the leakage here. And also never ever clamp the chest tube without doctor order. So clamping, C-L-U-M-P, clamping, we will not do it without doctor order. Okay, so I said it is very important, we have to know. So clamping here. And another one, the commonly NCLEX board, like the some of the information I can share with you. So in what medical condition or emergency condition we need to the clamping the tube. So keep note, always note it. The water seal is broken when you see excess bubbling, or when you see if the broken the channel or anything, then we can see excess bubbling, we have to clamping the tube. So always also keep in mind, pulled the chest tube out or hole, so cover the hole occlusively. So if any, like any emergency, suddenly remove this tube from the chest and you are in the in front of the patient, what you should do, you have to cover the area with a dressing gauze piece, I said. So we have to cover the hole with the occlusive dressing. Also, you should keep in mind, receive an order to help collect the cough or deep breath to prevent. So we have to educate patient, we have to teach the client for deep breathing technique. So teach the client to cough and deep breath to prevent the atelectasis or pneumonia. So the patient who undertake this chest tube, we have to educate or we have to teach them to cough or deep breathing. Why? Deep breath and cough can prevent atelectasis. They can prevent the pneumonia, we said. So what are the summary right now? So when a patient has the chest tube, we need two things. We need two things always at the bedside. One is occlusive dressing. Why? If any emergency, this tube is removed, the area will be open up. So if it is removed suddenly, we have to put the occlusive dressing. So occlusive dressing beside the bedside. Also clamping. So if an emergency, we have to do the clamp. So clamping should be there, and also sterile water. So if NCLEX board asks which things or materials or stuff we have to put beside or ready to the bedside for the patient who has the chest tube, three things. One is occlusive dressing, second is clamping, and third one is the sterile water, right? And as I told you, we have to educate your patient coughing and also deep breath technique to prevent lung atelectasis or lung collapsing. So it is very important for NCLEX board.
Dr. B.
Yes.
Which one you don't call